I chose to do my quality initiative project on decreasing exam room time. In the office where I shadowed the FNP, I noticed that there was a large amount of time between when the person was called back by the nurse and the time that the nurse came to the FNP telling them that the patient was ready to be seen. So I decided to follow the process from start to finish, and I noticed that a lot of the time in the exam room with the nurse was spent asking the same questions to each patient. So I decided that there should be a simpler process of asking these questions since the same questions were asked of each patient, and that it may help to improve times between when the patient gets to the exam room and when the FNP is actually able to see them. The model that I decided to use was the PDSA model. This is where you have plan, do, study, and act. And before you do that, you have 3 questions that you want to ask, which are, what are we trying to accomplish? How will we know that a change is an improvement? And what change can we make that will result in improvement? For this quality improvement project, what we're trying to accomplish is decreasing the time between when the patient enters the exam room and when they see the nurse practitioner. We will know that a change is an improvement because the time from when they enter the exam room to when they see the nurse practitioner will decrease. And then the changes that we can make that will result in improvement are implementing an intake form that the patient could fill out in the waiting room or even prior to their visit, maybe at home, to turn in to the nurse when they're being brought back. For the application of the PDSA model, the plan would be for 1 week, the office staff would keep up with the sign-in time, the exam room time, the RN entrance and exit time, and the APRN entrance and exit time. Then for the next week, the office staff will change the process and have patients fill out an intake form and then come back to their room. The questionnaire should decrease the time spent on questions prior to seeing the APRN in the office. For the do portion of this will be where for 1 week the front office follows their normal routine that they currently have in place, and for the next week they will follow the second routine with the intake form. During those 2 weeks, they'll collect data and record when the patient is entering and exiting each place and when the staff is entering and exiting each place in order to keep up with times. For the study portion, they will evaluate their data from the do portion and they will see if an improvement has been made in times based on the data that they collected. The front office staff, RN and the APRN, will also discuss with the patients that they engaged with the intake forms about what they thought about the form and if they spent more time filling it out versus waiting in their room for the APRN. The ACT portion of this would be based on the evaluation of the data collected, and the staff will either create a new plan and redo the PDSA cycle, or they will continue to use their current intake form in the plan that is already in place. Another PDSA cycle will be started if staff or the patient sees it is necessary based on feedback. With Kotter's 8-step model, you have the 8 steps that are also broken down into 3 sections. Your first 3 steps are in the section of creating the climate for change. Number 1 is create urgency. Number 2 is form a powerful coalition. Number 3 is create a vision for change. 4, 5, and 6 are in the section of engaging and enabling the organization. So you'll communicate the vision, empower action, and create quick wins. And the last section is implementing and sustaining for change, building on the change and making it stick. In regards to the PDSA model and the current quality improvement project of implementing a form, in stage 1 you would create a sense of urgency among the staff that you're working with for the need for this project. In stage 2, you would build a guiding coalition. So this would be a matter of gathering staff, whether it be just certain front desk office members, certain nurses, all of your physicians, all of your APRNs, whatever you decide, and then that becomes your team. Stage 3, forming a strategic vision and initiatives. That would be done by the team. Everyone may have different ideas or thought processes. You would tell them your vision and what you're hoping to accomplish. And then your initiatives, of course, would be that the patients are spending less time with answering questions face to face, but you're able to read their answers to the questions and then address the problems. Stage 4, enlist a volunteer army. These volunteers could be other staff members, but they could also be some of the patients that you are using the forms for. They could give you better ideas of things to put on the form, or maybe a different way to use the form, whether it be via technology or some way to take it home and fill it out prior to your visit. Stage 5 is enable action by removing barriers. Before you can do that, you have to acknowledge what barriers you have. And then when you remove those barriers, that should improve the process that you've already started with your vision. Stage 6, you generate short-term wins. So this would be maybe your entire process is not successful, but there are pieces within your process that are successful that you would call a win. And in the short term, those things are working out and you're seeing positives from them. Stage 7 would be sustain acceleration. So your vision and your process is moving forward. You've got everyone on board and you just want to keep that forward movement going. And this may be a time where you start presenting things to other coworkers, or you're telling other coworkers about how well your process is working. And then stage 8, you're going to institute your change. So this may be instituting your change among the entire facility, all of your front desk staff, all of your nurses, all of your APRNs, or it could just be really focusing on the change in your area. And in the case of this project, it would be for the congestive heart failure APRN, because she sees patients that are just there for congestive heart failure follow-ups. So therefore, she's able to keep that form very limited to questions that you normally ask congestive heart failure patients. Some examples of how the PDSA model can be used in primary care are that they enhance patient understanding of diagnosis, management, and follow-up at the end of an office visit. The improvement of the patient registration process, medication refills, immunizations, medicine reconciliation, diet management, exercise, community partnerships. Sometimes those are things like gyms or healthy eating and coupons for places like that. Hold times or wait times, no-show rates, and results reporting. So for this specific project, the goal is to improve your patient registration process. It starts with registration and it follows all the way through until when the patient is seeing the APRN. But by having the form filled out and ready, then the APRN is able to help with the understanding of the diagnosis of the patient, the different types of management that may be required to keep the patient healthy, and then they're able to focus on a plan for the next time that they are coming to the office. This may also help them to understand their need for their medications, how they should obtain those, or if they are having an issue obtaining those, how to get in touch with the APRN. Specifically diet management, seeing that this particular facility diet is extremely important in managing symptoms. And then hold times or wait times. The whole point of my quality improvement project is decreasing wait times in seeing the APRN from the time you enter the exam room.